Hi, going to be really low quality video, but I wanted to do this before I forgot about it. Today, I read an article that was posted by Live Action onto Facebook, and it was all about this ambulance came to this abortion facility. And I'll link to my other video where I say, you need to stop criticizing abortion facilities for calling ambulances. It's failing to call ambulances that is what gets women killed. But in this article, Live Action noted, and I'm bringing up my blog post I wrote about it, and there's going to be a link to the blog post below. The article noted there had been previous injuries at this abortion facility. In 2017, another patient had been taken by ambulance after having seizures they were not equipped to handle. Don't know that they should be equipped to deal with those seizures. I don't know enough about that to make a judgment call. One of the abortionists believed to work there, Deborah Levitch, let her medical license lapse in Alabama after claims she was not checking for viability before committing late-term abortions, falsified medical records, and allowed abortions to take place without a doctor present. All of that is very credible. These are very, very common things that abortion clinics and abortion doctors get caught doing. In each individual circumstance, yes, go ahead and get the details, but certainly, it's not like they're claiming that she's doing satanic ritual abuse in her basement. It's it's likely. Another of the abortionists, Herman Miller, killed a patient after botching an abortion and perforating her uterus. And I followed the link, and of course, they linked to the medical board disciplinary documents at abortion docs regarding the case. And I kind of cross-indexed it against my own records and found out that, they were referring to the December 6, 1988 death of a teenage girl named Katrina. Now, I had done a write-up on her based on a 1989 article in the Tampa Bay Times. And here's the summary I had written. Katrina was conflicted that winter of 1988. She loved her boyfriend. She wanted to have her baby. But the 16-year-old was so young, excellent in English classes at Raines High School in Tampa Bay, Florida. She had told some of her friends about the pregnancy. Some tried to talk her into following her heart and keeping her baby. Others supported her concerns that she was too young. On December 5th, Katrina left school early. Her mother brought her to a Jacksonville doctor's office for her 1 o'clock abortion appointment and stayed with her through the procedure, then took her straight home. That evening, Katrina kissed her mother goodnight and went to bed. She was dead by morning. During the abortion, the doctor had poked holes in Katrina's uterus and cervix. The bleeding was hidden, and Katrina had bled out. So in Cemetery of Choice, I cite the news article, and I also note that Life Dynamics had Katrina on their Blackman Wall of women killed by safe legal abortions. They cited her death certificate and her autopsy report, but they didn't provide any details. So I didn't have any further information. So thanks to the abortion docs document that I got, thanks to the Live Action article, I therefore learned a little bit more information about what happened to Katrina. And it went from merely a tragic death of this girl, this promising girl, but into something that we should be entirely united, pro-life, pro-choice. This is absolutely unacceptable. Not just what happened to her, but the fact that the rat bastard who did this to her was able to keep his medical license in this clinic, was able to remain open. Listen to this. So Katrina had a positive pregnancy test on October 31st, 1988. So on November 4th, she went to the family doctor who confirmed a pregnancy of about 14 or 15 weeks with a fetal heart rate of 140. Of course, the medical board disciplinary documents don't cover what the discussion was that Katrina had with her doctor. It only says that the doctor referred her to a woman's choice, also known as a Jacksonville Women's Health Center or Jacksonville Women's Health, because the doctor in question didn't perform second trimester abortions himself or herself. And this is something that just... Doctors, don't just send your page. Don't just pick up the freaking yellow pages or Google abortion clinics in your area and just send your patients to these people. You have no idea what kind of quacks they might be. Okay? Go to abortiondocs.org and look them up. You would have seen that this place is a little, maybe you would have sent her to someplace a little more reputable. Okay? Now, Katrina didn't report to the clinic for a month, which kind of confirms what the newspaper article said about her being really conflicted and having a hard time deciding whether she was going to follow her heart and have her baby or whether she was going to follow her head and have an abortion. And of course, it also seems, when she was looking at it as an either or, according to her friends, that nobody was referring to her to somebody who could help her continue her education and have the baby, which is something pro-life pregnancy centers do all the time. But of course, abortion clinics don't want you to know that they exist and that they do those things, because then there's no conflict. The woman can just follow her heart and her head and get to have her baby. And there is nothing more tragic for an abortion provider than to have to close your clinic down because your women are finding options that don't involve you making your money off of their situation. But at any rate, it wasn't until December 5th that Katrina went to the clinic. The clinic records show absolutely no evidence that anybody did anything to assess what she needed medically. Okay, totally take it as a given. And it's an abortion clinic. You show up and you sign the paperwork, you get your abortion. They are not in the business of helping you decide whether or not this is really the right thing for you. That's not what they do. It's not their job. They say it's their job. Oh, we provide non-directive options counseling. That's 100% unmitigated bullshit, unless the clinic's run by Charlotte Taft, and I don't think she's in business anymore. They are there. If you think you go into an abortion clinic and they're going to help you decide whether an abortion is right for you, that's like walking into a used car lot and thinking that car salesman's job is to help you decide whether or not this is the right time in your life to buy a car. Okay? That's not their job. And it's naive to think that it's their job. Okay? But we'll go ahead and we'll let it slide. We'll pretend that they've done their duty by Katrina to just, okay, she walks in, she signs, we do the abortion, no questions asked. No finding out whether she's being pressured by her parents or the baby daddy, or whether she's being brought in for an abortion by somebody who abused her or is covering up for abuse, which happens. Okay, we'll just totally let them slide on that. They did no medical history on her. Okay, they did not find out. They didn't bother to ask her that a month earlier she'd been determined to be in her second trimester of pregnancy already. They did not do a physical examination of any kind. Nothing. No documented physical examination and no ultrasound. So just line her up, queue her up, process her, right? Just like a cow at a slaughterhouse. You just get her on the line and process her. Okay? Nothing. Miller just charged ahead with a suction abortion, which is only appropriate in the first trimester. And some doctors are even a little touchy about doing it at the end of the first trimester. They want to be a little bit more careful. Not this guy. He just chugged ahead. Now, during the abortion, he noticed he's getting a whole lot more placental tissue than you would get for a first trimester abortion. Hey, dude, says the medical board, this would have been a really good time to stop what you were doing, whip out the ultrasound, and find out what the hell's going on inside this girl's body. Why are you getting more placenta than you should be getting total tissue for this pregnancy? But he didn't. He just chugged ahead, and he did not document what he did. He didn't document what kind of instruments he used. He didn't document any of this. He didn't even document that he assessed the fetal tissue after he removed it. Other than that, 22 weeks. 22 weeks. Now let that sink in a minute. Katrina was ambivalent about this abortion in the first place. She wasn't sure she wanted it. And he didn't tell her that he didn't even bother to find out, much less tell her that her pregnancy was at the point where her baby could potentially be born alive and live. And Yeah, a lot of women, that is definitely way too far as long as they're concerned. They would never consent to an abortion at that point. But of course, he didn't bother to find out. Nobody at the clinic bothered to find out. And of course, because they didn't bother to find out, they didn't bother to tell her. Okay? So after completing the abortion, Miller had Katrina in recovery for half an hour, which is not really long enough for a second trimester abortion. At this point, he knew that she was way at the tail end of the second trimester. He knew this. He should have been keeping her way longer than just half an hour. He sent her home with Stadol, which is a synthetic opioid, so she must have been in a lot of pain, an anti-nausea drug, and a drug to control obstetric bleeding. Now, supposedly, he didn't notice any bleeding, so why he sent her home with this, I do not know. And another drug that I Googled and can't find. I'm not sure what in the world is going on with that. But, the article said she kissed her mother goodnight, went to bed, and she was dead by morning. And the autopsy estimated that she died sometime between 2 a.m. and 6:30 a.m. And the medical board took some disciplinary action. They fined him. They called him a bad boy. And they said he should not provide second trimester abortions without. And they laid out all these stipulations for the supervision if he's going to do second trimester abortions. What? This guy doesn't distinguish between first and second trimester abortions. He doesn't even bother to find out if she's 6 weeks pregnant or 6 months pregnant before he dives in there with his instruments. Do you really think he's going to be following this stipulation and getting out his ultrasound and go, oopsie, this one's 13 weeks. I'm going to get the proper supervision to do. What the hell's wrong with these people? There needs to be somebody other than the medical board supervising doctors who screw up, because the medical board is just a bunch of doctors. There need to be patient advocates on medical boards. This just needs to be part of it. Where there's a patient advocate who says, no, good old boys network. This guy doesn't distinguish between first and second trimester abortions. He just chugs ahead. This guy shouldn't be watering plants, much less performing outpatient surgery. So, I keep telling people, you don't have to become pro-choice to recognize, you don't have to become pro-life to recognize that you cannot trust these people just because they are an abortion provider. Okay? The abortion lobby, which is funded by these people, want you to go through life with the assumption that these clinics are being supervised, all the reasons that it was supposed to be legal. Oh, so there can be state oversight and we can ensure safety and blah, 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 blah. And, the minute it was legal, the abortion lobby starts, let's get the state out of here. Let's get the inspectors out of here. Let's stop having this kind of supervision. There was a just absolutely Gosnell-esque clinic in Florida. The Miami Herald uncovered it, and the pro-choicers are like, yeah, it's really horrible, but please don't take any steps to correct this. We'll take care of it ourselves. We'll form this group that adheres to high standards. And just trust us. Seriously. Could you even remotely picture if some dentist killed a patient with an equal amount of quackery? And the state's like, okay, we need to have some more oversight at dental clinics here. And all the dentists banded together and said, no, don't look. We'll take care of it. You'd think there was something fishy. This is why they oppose abortion clinic safety laws, because they know if you look, you're going to find shit like this, and they don't want you to see it. Okay? If you have a friend, you have a loved one, you have a student, somebody in your Girl Scout troop, somebody at church, somebody you know is considering an abortion, or you're a medical professional, check these places out. You could be sending that woman or that teenage girl to somebody who doesn't even bother to perform an examination before doing surgery, who can't tell the difference between a first trimester pregnancy and a baby that you could deliver alive, put in a NICU, and he'd have a good chance of survival. Don't implicitly trust them, okay?